Hello all, I am Dr. Rohit Santhanam, Specialist Orthopedic Surgeon with Aster Clinics Fujairah. Today we will be talking about one of the most commonest orthopedic ailment, which is the low back pain. So the low back pain initially was supposed to be affecting only the elderly population, especially above the age of 50 years and the postmenopausal women. But in change in dynamics nowadays, the low back pain has been commonly found in younger population as well, between the age group of 20 to 40 years. This change in dynamics is mainly because of the change in lifestyle and the working patterns, and also in the post-COVID era, increase in the usage of digital devices like laptop, mobile phones and tablets have added to this menace. So the low back pain, the most commonest problem which contributes to the causative factor is prolonged sitting and abnormal posture during work hours, which leads to increased strain to the lower back muscles, which chiefly support the lower back and the spine. And also the most important contributing factor is the physical inactivity and the sedentary lifestyle of an individual. So when this problem arises to an individual, self-awareness is very important. So the patient should identify this as a problem, and the patient should immediately seek medical care and meet the nearest orthopedic surgeon available. And proper clinical evaluation is needed, because the causative factor of a low back pain can range from a simple muscle strain to a chronic back pain because of a disc bulge or a disc disorder. So after meeting an orthopedic surgeon, a proper clinical evaluation will be done and the exact etiology of the low back pain will be diagnosed. And appropriate imaging in the form of an X-ray or appropriate MRI scans will be taken as and when needed. Also, the most important aspect of treatment of low back pain apart from medication is the physical therapy, because the chief causative factor of a low back pain is going to be the weak musculature surrounding your lower back, spine and the abdomen. So supporting and strengthening these core abdominal muscles and the lower back muscles is a very essential factor for the treatment of low back pain. Hence, a careful and a corrective treatment and strengthening of the lower back muscles by a trained physiotherapist is highly essential. Hence, the treatment of the lower back pain is a multimodal approach, where the treatment starts from self-awareness, maintaining proper posture and proper physical activity which should be done by the patients, and then clinical evaluation by the doctor and proper strengthening and rehabilitation by the physiotherapist. We at Aster Medical Center Fujairah, we have a full-fledged orthopedic outpatient department and imaging facilities in the form of X-ray, and as well as a fully equipped physiotherapy center with a trained physiotherapist. Any ailment pertaining to lower back pain or associated disorders, kindly reach out to us and you can fix up our appointment with the front desk and we will be happy to help.